Well, Joanne, thanks for joining us. Joanne is one of our partners here at Ferla Group. Joanne is the owner of Giardini Medicare. She's based in Michigan. She has her own firm helping people transition to Medicare when that time comes for them. We started working with Joanne a few years ago. We started getting more and more questions on Medicare, given that we have 3 certified financial planners here. We know the details, but we wanted someone that does this all day, every day, helping our clients navigate this process. So we have a partnership together. And before we get started, just a quick disclaimer: the views reflected in this commentary are subject to change at any time without notice. Nothing on this webinar constitutes personal investment advice, performance data, or any recommendation that any particular security, portfolio of securities, transaction, or investment strategy is suitable for any specific person. So with that, Joanne, I'll let you get started. Say a little bit about yourself and how you help people.
Sure. Thanks, Regis. It's always fun to come in and kind of do these webinars. Hopefully you find this recording at least helpful with answering some of the overview questions that we get. So as Regis mentioned, my agency is a Medicare agency, and all we do is Medicare. So we've got a team of 9 agents that we do 100% Medicare. So after a while, you kind of start to know this stuff. But along with his disclaimer, things are subject to change. So don't take everything here with everything set in stone, because it's certainly not. That's one of the hardest parts to Medicare, is there is not often an absolute situation or answer for every single person. So therefore it's pretty individualized. So what we do is Medicare consultations. I do always want to point this out. You can see on my screen here that we're an insurance agency. So a lot of people, when I do these sessions, people think I work for the government, and I don't. We talk a lot about the government interaction. You know, it's a big part of what we do, but we don't work for the governor. We don't work for Social Security. We don't work for Medicare. We know a lot about those 2 areas, or Medicare specifically, but that's not us. We're an agency. We're just agents. At the end of the day, we get our fees and our commissions from insurance companies, just like your home and auto insurance person would. So we don't get paid by Ferla. Ferla doesn't pay, we don't pay them, they don't pay us. So it's a great kind of relationship. And we're kind of just here to be the arm for some help in enrollments for when the cases are appropriate. Regis, I think we can just kind of jump into some of these things. Stop me wherever. And I know you've got some questions, but the premise of Medicare, honestly, why I got into this is because it's so confusing for people. And about 6 years ago, it was pretty amazing that I still find it amazing that you've got a product that every single person has to deal with at age 65, at least at age 65. And
so is it mandatory that you have to do it at 65? Everyone has to do it?
No, which is a great thing to point out. So that right there is one of the biggest myths. And so a lot of 64-year-olds, they start to get stressed at age 64. And a lot of it is because of just what's on my screen, is the stress of the postcards, the mailers, the agents, and everybody kind of telling you got to do this and that. So no, not everybody has to do Medicare at 65 years old. So a lot of our job, and this sounds really stupid, but it's helping people figure out if they need it or if they want it at age 65. And that's where a lot of the mistakes happen. So the industry really is designed to cause you a lot of chaos and a lot of stress around that. When you make a mistake, somebody else is usually making money. I talked to a guy the other day who's been enrolled for 10 years in the Medicare system on disability. He didn't need it for 10 whole years. So he paid minimum of $150 a month for 10 years for coverage he didn't need. So boom, that's a big mistake that you can put with you guys for investing in a better place than unwasted, unnecessary insurance. So, common question for us: can I figure this stuff out on my own? You can. Kind of good luck. You'll spend so many hours, it's ridiculous. And it's a rabbit hole of where do we go get information? Nobody, the search bar is designed to just suck you in. Next thing you know it, you're on different websites, you're putting your phone number in, your email address, and you've got agents calling you from call centers all across the country. So just be really careful of that. And I don't recommend that. I do recommend just really kind of trying to discern what is good information and what is not good information, which is extremely hard for you all. This is a piece on my screen here from Costco magazine. They put this out a couple of years ago, and it's actually incorrect. The upper right box just says you have to enroll when you first are eligible, which is exactly what Regis just said, because you're eligible at 65. And he asked the question, does everybody have to sign up at 65? And I answered no. So this Costco piece says, yes, you do. It says if you don't, you're going to get a Part B late enrollment penalty. And they actually word it incorrectly. They call it Plan B, which it's not, it's Part B. So we get really fussy with that stuff, but it's a big deal. So somebody reading this magazine would just go off and say, well, they got to go do Part B because Costco magazine said I got to do it, which is stupid. So it's just, this is where the whole stuff starts. And then you tell a friend or your friend tells you this information and they read it in Costco and it happened to be written by a doctor who's an MD that knows nothing about Medicare. So it's very difficult. So, you know, that's kind of why we are doing what we're doing as a group. So we focus, again, as we just mentioned, it's the transition to the system. So our work is typically people going to be, they're turning 65 and they do need Medicare. They're going to be people that are, you know, retiring. You know, pilots, we know at 65, they're done. So therefore, you know, they have to look at their options. Some have retiree benefits through their airline, some don't. So we are working with the people that don't have those retiree things available to them. You know, if you've worked for 35 years and your company doesn't offer retiree coverage, that's a phone call for us. Okay. But if you're going straight to the association programs, or you're a school teacher or a government FEHB worker, things like that, you have TRICARE for life, a lot of you guys do. Those are not cases where we work with those people because you don't need an agent. So don't get lost in the system because you're going to stress yourself out just by that. Just know you need to go directly and talk to TRICARE. You don't necessarily need agents. Okay. So again, we're helping in that transition. So we ask our—
So someone, a pilot or a former military person that has TRICARE, do they need to sign up for A or B? Do they need to do anything? Or does just TRICARE kick in?
They do, well, they TRICARE, it's unusual or a little different in that I talked to somebody recently who he said to me, and it was kind of funny, it was a retired doctor, and he said, I think I might be eligible for TRICARE. And I said, well, you think you might be eligible? That's kind of strange, but go find out if you're, you know, if you're eligible. You should know. It's one of the big things with Medicare is know what you're eligible for. And he didn't, which was a little strange, but he called me back and he just said, you know, yeah, I found out that I was enrolled last December. So 5 months later, he figured out he was enrolled in TRICARE. It correlated with his A and B enrollment though, with Medicare. So we don't administer TRICARE. So I assume that they're talking to one another and they just enrolled him without his knowledge. And he didn't know because he doesn't pay any premium. So it's a great program, but definitely touch base with TRICARE. So when you retire with TRICARE, yes, you need to have A and B. It's basically they're giving you a free supplement, which is phenomenal coverage. In my opinion, you really don't need anything beyond that. Now, some agents will tell you that, yeah, add a Medicare Advantage plan just for some little perks. You can do that, but you just got to be careful because you could risk some billing snafus. And I don't know, you just got to weigh off if a couple, you know, cleanings a year for dental are worth kind of the potential. You know, I don't think so, but it's up to you guys. But yeah, so when we're talking with people, we're poking around, asking a whole bunch of questions, you know, we're trying to teach them, you know, what Medicare really is. It's just insurance. Do you need it? How do you go get it? How much is it going to cost you? What is it going to cover? How do you put all that together? And then kind of the reality of, you know, how many cars do I bring my doctor? That kind of stuff. So that's part of what we are doing when we're talking to people. So no question is a crazy question. There's a lot of stuff that goes on into that. But our goal is just to kind of get you into retirement and just relax about your health care. So we spend, you know, a lot of time talking about Medicare Advantage plans versus Medigap insurance. And those are two very different things. So we did a survey recently with our clients, and they said that was the hardest part of transitioning into Medicare was just trying to understand Medicare Advantage versus Medigap. So hopefully today I can make that a little bit clear. I do want people to understand that pre-existing conditions really do play a big piece in Medicare. So pre-existing conditions do matter. And if you've got issues heading into Medicare, you got to be really, really careful about your coverage. If you have COBRA insurance and you have Medicare, you got to be careful about that. Medicare and COBRA do not interact very well. So there's some special rules there. So don't ever consider COBRA insurance while you're Medicare eligible, and the keyword is eligible there, without talking to an agent, okay? And the whole thing is a big process. So we take multiple steps with people as we're walking through, kind of this, because there's just a lot to it. So again, I know today is fast and furious, but it's just designed to be that overview for you. So when we just sort of talk about what Medicare is, it's health insurance. You know, people get really, I think, kind of wigged out more because it's the government, you know, offering this health insurance. But just try and think of it like Blue Cross or Anthem or United Healthcare, or whoever you have. It doesn't matter. But it's just insurance that is not designed to pay 100% of your healthcare costs. Think of your group insurance today. That is also not designed to pay for 100% of your healthcare, right? You've got maybe 80/20, or you have a $5,000 deductible, things like that. So just like that, Medicare is going to be an 80% kind of coverage situation. It's designed to be used in the United States. It's not designed to be taken over to Spain for 5 months. It's just not. Just like your employer coverage is not designed for that. Okay, I'm not saying it's not going to work in certain situations. It's just not designed for that. And again, eligibility, going back to that, you know, who's eligible? When you're 65, you're eligible. If you're disabled, after 24 months, you're eligible at any age. Doesn't matter if you're 28 or 52, but you're eligible after 24 months. And then there's 2 medical situations where people are fast-tracked over to the Medicare system. And one is end-stage renal disease, and the other is ALS. Okay, so those are luckily not very frequent, but they happen. So what Medicare is it's 2 parts. You got Part A and you've got Part B. So Part A is just hospital coverage. Part A is generally free if you go and enroll in Part A. It does have deductibles. It's got co-insurance. It's got things like that. We're not going to hammer into those costs because as an agent, again, we're putting in a product later that plugs those holes. So you're not seeing those deductibles and co-insurance and things like that. Do want to point out that long-term care is not covered with Part A, because a lot of times people see skilled nursing and they think of nursing home coverage. So understand that it's not going to be covering those types of situations. That's one of those things where you go back to your advisor and you talk through how are you going to handle that should it occur. And I will say the stats are pretty high for needing some long-term care, whether it's custodial services, things like that. You know, you just got to be careful there. Other part of Medicare, we got Part B of Medicare, and Part B is more like your doctor services, your CAT scans, your x-rays, your chemo, radiation, things like that. Again, just a couple things here. Medicare has a premium. So Part B comes with the premium. So some people come in thinking that Medicare is free, and I'll just tell you it is not free. There's a cost to that. Higher net worth people are going to pay more. So I'm going to get to the cost pretty soon. Do understand that again, there's 80%, 80/20 is Medicare. So you are responsible for 20%. If you do not do anything beyond Part A and Part B, having no supplement or no Medicare Advantage plan, you are going to get stuck with 20% of your bills. And those can be costly, you know, and a simple knee replacement can yield $10,000 to $12,000 in bills for you for the 20%. So it happens. Do not be in that situation. Always get a supplement or something to go along with your original Medicare. Some things quickly that original Medicare is not going to cover: dental. Dental is a big gripe for people, nonstop. Implants are expensive, root canals are expensive, things like that. Save your HSA dollars if that's how you're going to pay for that, for dental. Same thing with vision, not as costly as dental in my opinion, but Medicare is going to cover glaucoma. They're going to cover cataracts and such, but they're not going to cover just standard vision exams. They're also not going to cover hearing aids, things like that. They're not going to cover gym memberships, and they're not going to cover prescription medications. That's a whole separate program. So just some things to know. You know, we always joke about where people go for advice, and you all go to the wrong places for advice. So I'm just going to leave that very short and sweet, but be careful who you're talking to and kind of what you're listening to. So again, I touched on this a little bit earlier. When we go through, we're looking for eligibility for Medicare. Because again, if you're eligible for TRICARE, you don't need to be talking with us. You need to go contact TRICARE because you're automatic. You're in a great situation. Do not get snookered into all the ads out there and all the agent phone calls, because you got to remember too that everyone's trying to sell you something in this space. It's you're definitely a target at age 65. So we're always trying to figure out what you're eligible for. Like I said earlier, knowing what you're eligible for is just huge. Knowing that you have the access to TRICARE for life is phenomenal. So you should know that. But a lot of people just don't start there, and they talk to their friends. And if their friends are buying something on the market with like somebody like us, they think that they should be doing that too. And it's not true. So everybody's situation is really unique. A lot of people are still working past age 65. If you're not a pilot, you can work past 65 freely in your salaried job at Ford, things like that. then you don't need our insurance for a while. So again, if you have insurance, you don't have to get Medicare at 65 unless you work for a small employer. If you work for a CPA firm with 5 people, you do have to get Medicare. So this is where Medicare's kind of squirrely. You got to know the rules. You got to know if you're in a small employer versus large employer. So some of those things are good to check in for. Cobra, if somebody's on Cobra, they have to always get Medicare. So I can't dive today much into these situations. Just know that there are situations where you absolutely have to get Medicare. And there's some where you don't have to get Medicare. So that's the hardest part of figuring out, do I need it or do I not need it? That's really the crux and the hardest part of Medicare. And that's where the problems start. ACA and Marketplace, if anyone's listening and you just buy your own insurance, you're a small business owner, you're paying $1,400 a month, something like that, you need to go get Medicare. So automatically at 65, you do need Medicare. All right. So everybody's situation, again, is just very unique. I'll talk about this at the end for a second too. We always advocate at 64 and a half, just get to a contact person. It doesn't have to be us. It can be us, but a quick 10-minute phone call will just kind of ascertain whether you need Medicare or you don't. When people do need it, we continue the conversation, right? Because then we want to know, well, how much is it going to cost? How do we go through and get enrolled? All that kind of stuff. So that's where this comes into play. This is our chart for higher net worth, or actually the entire chart. So the base rate of Medicare this year, 2019 or 2021, is they're looking at a person's 2019 federal tax return. So that's how they're figuring out what you're going to pay for Medicare right now. So now the base rate this year is $148.50. And you can see on this chart that the top rate is $504.90. So there's a big spread in between. Yeah.
Yeah, Joanne. So particularly for pilots or someone just retiring at 65, pilots are making a nice captain salary at 65. The day they, before 65, the day they hit 65, that income drops dramatically. So how do you handle that with, they're going to get charged $475 or $504 a month maybe, but they really shouldn't be because that income is going away.
Right. And that's exactly where a lot of people don't know with this. So again, they're going to look at your 2019 tax return. So a pilot coming out today is going to be like, well, wait, I'm not making $350 anymore. I'm retiring, and Regis has me set it, and this is the conversation. It's just really, okay, close your eyes. And what are you going to make for the next 12 months? Well, Regis set my wife and I up to we're going to cap out at $150 a year. That's what we're going to start with. Okay, great. Then we have a form. There is a form called an SS44. You can grab the form online. Just Google that, SS44. You can get the form, you fill it out, and you just kind of ignore your salary. Forget that you made $350. Just kind of go forward. In the next 12 months, you're going to make $150 because that's what you're going to live off. On that, again, look at the joint tax return line. If it's under $176,000, then you're going to be reduced. So they will always, we've never seen one not win, successfully, I should say. The Social Security Administration will move you from the $475 a month per person premium down to the $148.50 per month. And they'll do it the following month, or they'll even go retroactively if you just found out 2 or 3 months later that you can do this. So it's really important to do that. And if you don't do that, let's just say you didn't hear us, you didn't talk to Regis, you didn't talk to me. So you pay $475 a month and you're grumbling, and then next year, let's say it's still based on your income. Because again, in 2020, you were still working because you just retired in 2021. But the following year, it's ultimately going to get reduced down when they start seeing that, you really are living off $150. But don't wait. Okay. Do not wait.
So you got to be proactive with that stuff because it'll drop off, but after you pay a couple $1,000.
Right. You ding yourself $5,000 a year for 2 years. Exactly. That's where all these little mistakes start adding up to big mountains of money. Same with, this is the same surcharge situation on Part D. If you don't know to do that, you're going to pay an extra $70 a month per person per month just from having a drug plan in place on top of that other charge. Well, if you put that SS44 form in and you're successful and boom, you go down to the base rate. Now in this one, you're paying $0. So do you want to pay an extra $70 for no reason or $0? So be cognizant of that. The other thing to focus on with these charts is that when you're working with you all at La Ferla, this is an opportunity to talk about when you're 63 and 64 that this is coming, right? To kind of plan for it, just to put a follow-up, or maybe you're taking buyouts differently, or you're selling a business property, whatever you're doing that's going to affect your income. just know that this can be, ahead of you. So that's always a really good opportunity for doing that. So once, again, we go through the whole cost structure with the person, then we got to get them enrolled, technically enrolled into Medicare. So how do you do that? Well, there's a couple different ways. So one is when you're approaching 65. A lot of people know this 3 months before, 3 months after my birth month, they get inundated with, like I said, solicitations, and stress kind of creeps in here. Like, what should I be doing? But this simply means that you're approaching Medicare. You have the opportunity to go sign up if you want it. Doesn't mean you have to. It just means if you need it and you want it, you can do that. The only time, let me point out here though, is if somebody is collecting Social Security at age 65, let's say they started drawing at age 63 for some reason, they are going to be enrolled in the Medicare system, Part A and Part B, automatically at their 65th birthday. Now, it does not mean they have to keep Part B as in boy. If they have coverage elsewhere, they can still say, no, thank you, I don't need Part B, but they're going to automatically be enrolled. The rest of the world, if they're not collecting Social Security, are people that have to be proactive, and they have to go to the website and enroll in A and B. All right, so it just works a little differently. Then it also works very differently if somebody skated past age 65, maybe they just signed up for Part A, they did not do Part B. Well, now they're coming out at 67 years old because they're stopping, their salaried job with a healthcare place, whatever they're doing. They're calling and saying, hey, I'm going to retire in August. My coverage goes through the end of the month. I need coverage with Medicare to start September 1st. So that's what we do a lot of. So then we're trying to just, start the new coverage when the old coverage ends. So we're starting a Medicare package for that person on 9/1. They're not getting penalized. They're just putting things in order. We're indicating to Medicare when we want their coverage to start. So it's actually pretty easy. And going through all of that, again, those are the pieces that we're dealing with the government. So that's when I said that people think we work with the government. We don't. So we just kind of do that as part of our taking care of our clients. And then right here, after we get their A and B squared away, we know what they're going to do when it starts, then we turn into insurance agents, because then we got to talk about the products that go with the original Medicare. So again, this is back to that Medicare Advantage versus Medigap and what that looks like. So this, I hope I can make it relatively clear to you. When somebody hits this stage, you only have two choices. And that's what I like about it. It's just there's two, right? It's like, yes, we can have confusion, but just understand there's two choices. Pick one side or the other. So what we try right out the gate is trying to get somebody to understand what side of the fence they really are on, because you've only got the two choices. So one way you can do your Medicare coverage is you can retain original Medicare, meaning you stay in the A and B system with the government. You pay the government a premium, and then you simply add a drug plan, and you add what we call a Medigap contract. It's a supplemental insurance policy. The only reason you're buying that policy essentially is to pay your bills. And I'm going to go through an example next, and I think it'll become more clear. But what's nice about original Medicare is that original Medicare covers all 50 states. It is your primary insurance company. So you can go to any doctor you want in the entire country that takes Medicare, any surgical facility, any hospital that takes Medicare. 98% of them do. So it's a very easy system. You pick your doctor, they take Medicare, you go. Your supplement is just there to pay the bills. Okay, so that's where you don't worry about the name of the carrier and all that kind of stuff to a large degree, because it's just there. It's going to operate the same as the next carrier, because it's just designed to follow original Medicare and pay the bills. Got to add a drug plan. We always make people buy a drug plan, even though it is technically optional. If you don't, you're going to get a penalty. I'll talk about that a little bit. But Medicare Advantage is the whole flip side to original Medicare. So Medicare Advantage plans are very different. You're still going to pay your Part B premium, however. So make that really clear. You're still going to pay Medicare. No matter which path you pick, you're still going to pay your dollars to the Medicare system for coverage, that Part B premium, always. But with Medicare Advantage, and this is from the handbook, look at the words here. It's an all-in-one alternative to original Medicare. When they say alternative, they mean alternative. It is, you are not in the A and B Medicare system any longer, okay? So these are private insurance companies that now are going to bundle all of the services that you could have gotten with A and B of Medicare if you stayed in the original Medicare system, but they're going to bundle it into a program, and they're going to, you're now going to have networks, you're going to have co-pays, you're going to have different things you have to deal with because you decided to enroll into the Medicare Advantage plan. So it can be convenient to some degree because you've got your A and your B together. You've got drug plan typically thrown in there. You've got some extra things like dental vision, things like that they know you're looking to get as a consumer. So they package all of that. Downside, you're going to have networks. You will have copays and things like that. You may have prior authorization restrictions you might not like. You might lose some freedom that you might not be interested in. So you do want to make a really good decision when you start Medicare because of this. And I'll run through this little financial example. But I just want to make it clear that, like in this case, I'm showing just a 65-year-old person here in Michigan where we're based. This person pays, they buy a Plan G, which is today's current Cadillac of insurance, and they pay $115 a month. So that person pays that flat $115 a month every single month. They have a $203 deductible this year because that's the part.
That $115 is on top of the Part B, right?
Yes, exactly. So on the very bottom, it says plus the Part B premium payable to the government. So yes, always making it super clear. You pay $148.50 at least. You pay $115 extra. And then in this case, the person has a $203 deductible to satisfy. And then once they do that, everything's paid for. As long as Medicare approves it and it's medically necessary, every single thing is paid for. I don't care if it's chemo or radiation. I don't care if it's physical therapy. I don't care if it's skilled nursing. If you're in the hospital for 8 weeks, doesn't matter. Everything is covered at zero. So it is phenomenal insurance. It does not come with dental. It does not come with vision. You have to add a drug plan separately. So those are your costs. Okay. So Medicare Advantage, totally different arrangement. Again, you're going to pay that $148.50 to the government at least. You're going to pay that every month. However, in this case, this person decided to sign up with a PPO plan in Michigan for zero. So the plan premium is zero every month. $148 to the government at least, zero to the insurance company. They have a max out of pocket of $5,300. Okay, so at least you have this financial, protector. Again, with Medicare, you only have 20% unopened. At least this point now we've introduced a financial cap to this person's world. So that's a good thing. All right. So in this case, doctor visits are free, but you can see the fee schedule that kind of leaks into this. Your specialist visit's $40. Go to the hospital for 8 weeks. Well, they're going to get a bill for $350 a day for days 1 through 5. All right. 20% co-insurance on chemo radiation. Those can be big numbers. And skilled nursing, you're in there for day 21 onward, you're going to pay $178 a day. Physical therapy one is, we always point out that because a lot of people don't factor those in, but if you have a knee replacement and you need 15 PT visits, that can start to add up. So people are a little bit surprised when it happens. But anyway, they offer a little bit of dental. There's two cleanings a year, x-rays, $100 eye allowance for vision. And then often the premiums for the drug plans are zero. So not to be confused with free medication. So some people think their meds are going to be free if they go Medicare Advantage, and it's absolutely not true. Okay. So again, you can see it's just bundled approach. It's an all-in-one kind of system. It can work for some people, and then it just doesn't work for other people. This is why we take a lot of time and effort to try and make sure that people understand what they're buying out the gate, is because the last thing you just saw, Medicare Advantage, can be very, very attractive to that 65-year-old, very healthy, non-medication taking person. And it is attractive. The problem is when people don't like their plans is when they're using their plans, when they need to use their plan. Let's say that healthy person at 65 gets a diagnosis 3 years later of a cancer diagnosis. And suddenly, they have to be dealing with the system, and they have to pick a doctor, and they have to go through some procedures, and, maybe it's chemo or something like that. When they want good coverage and they come back to us and say, hey, I remember, hearing about Medigap. I know it's better coverage. I don't care. I'll pay $150 a month now. They can't have it when they have a cancer diagnosis. Okay. So it's really important to understand this. So this is the pre-existing condition problem. So when somebody is coming up to Medicare, when they're starting their Part B, you could be 65 years old, you could be 68 years old. It doesn't matter when you start your Part B, but when you do start it, you have a 6-month period of time that you can go buy any Medigap policy on the planet that any agent sells, and you can get that policy without any medical underwriting, meaning we don't ask a question. We know, your health generally when you're turning and signing up with us, because it's all just coming out. It's coming up. If we have people that have a current cancer or had breast cancer 2 years ago, or have lupus, or have a significant illness, we will definitely push you to get Medigap, because we know this is your only opportunity. So we have a lot of Medigap people. I will just tell you, 90% of our book of business is Medigap. here's what everybody wants. I mean, I just know this from years of doing this, that every single person out there wants the Medigap plan in the middle. They just want it to cost zero, like Medicare Advantage does, and they can't have it that way. So you just kind of have to look at it as you're going to sacrifice something. You're going to either sacrifice dollars up monthly that maybe you feel like you're throwing away sometime, but if you use it, you're going to love it, or you're sacrificing potentially freedom and your own decisions and things like that if you go Medicare Advantage. Because remember, you are dealing with the plan. They will dictate, skilled nursing places you can go to, facilities you can and can't go to. It doesn't matter if your daughter wants you 2 miles from her house, you're going to go to the one 25 miles away because they contract with them. So if it's okay with you, then that's fine. So we spend, again, our time is trying to make you feel like, think of yourself as a 75 or an 85-year-old you. There's a lot of perks to Medigap. You have control. Budgeting is rather easy. Snowbirds. We have a ton of snowbirds from Michigan going back and forth between Florida, Arizona, things like that. Works great. So they can do 6 months of treatments up here if they need to, or in 6 months they can go anywhere they want. For travelers, we've got RVers, things like that. So it depends on your lifestyle to some degree, and you got to be okay with higher premiums. You have to be able to afford it and be okay affording that. Okay. And then Medicare Advantage on the flip side is great for affordability. Not everybody can afford Medigap. And believe me, we have those people. So that's okay. We make the best of what we can. Under 65, if they're on disability, that's a really big market for Medicare Advantage. Veterans, if you're a veteran, definitely get your Part A and B of coverage and then add a Medicare Advantage plan. I'll talk about that in a second too. But again, there's a subset of people out there that are just okay with networks. They really don't mind. They sit here in Detroit. They don't really leave their confines. They don't travel. They're okay with that. And that's fine. Veterans, just a little special piece of veteran advice is this is people that are relying on the VA, let's say they don't get TRICARE for life, but they rely on the VA hospitals. They should always get Part B with Medicare, in my opinion. It's not required, but you should get it, because if things change and in 5 years you do want to get it, you are in a penalty situation with a late enrollment for Medicare. So why would you add a Medicare Advantage plan? Always I would, because if you're relying on only the veteran hospitals, like for example, we only have 5 VA hospitals in Michigan. Well, what if you're 2 hours away from the VA hospital? You need emergency care, things like that. It's a pretty high bar to get that kind of stuff covered with the VA. So at least you've got something out of network. You can go get second opinions. You can get some extra dental vision, things like that. And then there's even some plans that will rebate some of that Part B premiums too. So, the other thing, it just creates a max out of pocket for you. So there's a lot of really good features to Medicare Advantage. That's where I'm all in for getting those folks a Medicare Advantage plan. Medications, I'm not going to talk too much about it other than this is called the donut hole. People get very worried about the donut hole. Some people don't ever even have to think about it because they hardly take a medication and they're still worried about the donut hole. But it really is just it's a pricing mechanism that Medicare sets. CMS sets this pricing strategy. It's confusing. Only pay attention to it if you have high price medications. We have a YouTube video. I'll show you our YouTube channel in a second, but that's where you want to kind of focus if you need to learn more about the donut hole. We've got a video all about it. But Part D in general is always get a Part D plan. If you don't get one, you're going to get a penalty. You probably aren't going to find out that would have happened to you. We get a lot of those calls that, hey, I'm 70 and never had a drug plan, but I need one. You can't just go get one when you need it. And that's the other bad part to these plans is you can't come mid-year and say, hey, I just got put on Eliquis and I want a drug plan in June. It doesn't work that way. So you're gonna have to pay $500 a month for Eliquis until we can get you a drug plan in January. So always get a drug plan. If you don't take medications, this is a very common thing. You don't take medications at 65 or whenever you start Medicare, get a very low-end, cheap drug plan. So every carrier, most carriers have low-end pricing. Just get something cheap to be a placeholder so you don't get penalized. If you are on Medicare and you have a Part D plan, make sure you're checking your plan every single year because the plans change a lot. So you're going to potentially lose a bunch of money if you don't shop your drug plan. Timing of things that we do, we're busy year round with the retirees and the new 65-year-olds, but our fall is extra busy. October 15th to December 7th, that's our time when we do change up drug plans for our clients. We change people from Medicare Advantage plans. Maybe they were in one and they didn't understand it and they don't like it and they're healthy enough. They can actually get out of that and they can qualify for Medicare. If they pass underwriting, we can get them all set up for January 1st. We can also do the same thing in January, February, March for those folks. Medigap, we do come across people too that meet, you know, they have an old plan F and the prices are going up. If they're healthy enough, we can move them to a new Medigap plan, but that's any day of the year. And then all the rest of the year, we're dealing with the retirees and the turning 65-year-old folks. So a lot of chaos constantly. I already talked about this, but when do you start talking about Medicare? Just avoid the mistakes. You know, so much, you know, we even say 100%. Absolutely, things can be avoided when you're talking to somebody before you have to deal with the Medicare decision. It just, if you don't, you really, really can make a lot of crazy mistakes. Okay. So if you want to self-learn, a lot of people love to just curl up with YouTube. Great. We love it too. So go to YouTube. We have a YouTube channel. There's a lot of other agencies that we know across the country too that do a really good job with YouTube. You can learn a ton. This is my oldest son. He runs our YouTube channel. So we've got about every topic covered that we can think of, and he's going to start rehabbing these videos pretty soon. But everything, how do you sign up for Medicare at age 65? How does Medicare deal with the shingles vaccination? I mean, just every little kind of crazy thing. There's one on how do you appeal your IRMA charges? That's the high net worth. So that's a good one for the pilot to go to and watch that. You know, he walks you through every single piece of that. So a lot of that is in there. So be, you know, again, be a self-learner, you know, get your questions ready, go to a good agent, things like that. We're going to start podcasting in August. So I'm pretty excited about this. We're going to do a 30-minute session every 3 to 4 weeks. The first one's going to be about the annual election period. What do you do? What can you do? What can't you do? What should you do? What shouldn't you do? Things like that. So that's going to start up pretty soon. Our website, we've got content on the website. Typically, I'm sticking around for Q&A, but we're not going to do that today. So I'm just going to leave this with my contact information at the end. You are welcome just to call the general office number if you have just general phone calls. If somebody needs Medicare, again, if you're retiring and you don't have access to any health insurance and you need help, we can do that. So there are some states though too, I will kind of say, Regis knows you can contact Ferla and they can tell you our key states. There's some we don't cover. And then we just refer out to some other agencies that we know that do a good job with Medicare as well.
All right, Joanne, I got a few things I want to just reiterate. So when the great Joe Namath's on commercials selling Medicare coverage, that's Medicare Advantage, correct?
Joe Namath is pushing absolutely Medicare Advantage. He was hired, the story is that we know it was hired by us call center in Florida. And I don't know how much they paid him, but he produced a lot of business for this call center. So it's definitely Medicare Advantage. Anything that's going to light up on TV that says, you know, call for your free this, call and see if you qualify for this. The other thing he was really advertising for was for Medicaid people. So Medicaid and Medicare people combination. If you're on both of those systems together, you will qualify for everything free under the sun. That is what Joe's talking about. You know, and he said, if you listen this year, you'll see or listen to his words. It says, you know, call us and see if you're in the zip code that qualifies, because it's zip code driven and it's state driven, things like that. But yes, think about if it's too good to be true, right? Probably is. And there's no free lunch with this stuff. So yeah.
Yeah. So back to one of the points you made, Medicare Advantage. Let's say I live in Florida. I have a cancer diagnosis. I have to stay within my network. So if I wanted to go to MD Anderson or Johns Hopkins, that might not be available to me.
Right.
Is that available? Is that if I have Medigap, can I choose NYU, MD Anderson, Johns Hopkins? Is there any restrictions with a Medigap policy in that kind of scenario?
Right. And really good thing to point out. So in that case, MD Anderson is a great example because they do not take any Medicare Advantage plans ever. None. Some of the Johns Hopkins, they might, you know, have their own because the Johns Hopkins actually has their own Medicare Advantage plan. So, but that's unique. So if you're just a Florida resident and you want to travel and go to, I had that happen actually with a client's sister. She bought a Medicare Advantage plan, did not know what she bought. She got a diagnosis. She wanted to be treated in Michigan. She could go, but she was out of network. So she had an out of network max of 10,000. So she paid the 10,000 to go get her treatment. If you have Medigap in that case, the only thing you need to do is call ahead and make sure they take original Medicare, which all of those places do, and you can go. So it's that simple. And you go and you pay zero because you've met your deductible of 203. So that's how much control you have with Medigap and original Medicare.
All right, and if I have an HSA, a health savings account, how does that interact with original Medicare, Medigap, Medicare Advantage?
So when you're coming up, if you're funding your HSA and you're actively working, one of our questions is always, are you, you're still working? Yes. My last question is, are you funding your HSA? If they say yes, then it becomes a question of a discussion about, do you want to keep funding your HSA or do you want to get Medicare Part A? You want to enroll in that? Which one do you want? Because I'm an advocate of funding the HSA myself. And that person may want to not go and file for either A or B or Medicare, because if you enroll in either one of those, you are no longer eligible to put money into your HSA. Doesn't mean you can't use your funds. It just means you can't put money into it, and your employer can't put money into it. Nobody can put money into that account. So be careful with that. The only time you're kind of be shut off, kind of, if you're taking Social Security, you're automatically enrolled in Part A, you can't give Part A back. So you're going to have to stop funding the HSA. So it's a little different. Now, when you stop working, you can use the HSA, you can use it on a spouse's, you can pay yourself your Part B premiums, you can reimburse yourself for that. You can pay all your drug plan, your dental, all that stuff. You can use those things forever. So I think they're great accounts. You just got to be careful about the timing of Medicare. All right. So that hits on most of it.
All right. And then one last thing I want to reiterate. So if someone's past 65, they've already enrolled in an Advantage plan or a Medigap plan, they want to change it, they have to go through an underwriting process at that point, right? So is that correct?
It is. So the Medicare Advantage plan people, their opportunity to come out is late in the year and then early in the first quarter of every year. They have to go through underwriting, and then we have to get the Medigap approved first and make sure you verify the premium that you're getting approved for. And then once we file a drug plan for that person, that will cancel out their Medicare Advantage plan. But there's only certain times of the year you can do that. And so that's what makes it dicey, is you just can't presume you're always going to qualify, and you got to qualify during that time zone. So it's not like you can just change anytime you want. That's where the industry is really misleading. Just they kind of act like, well, you can just change your plan anytime you want at open enrollment. That's not as easy if you have an issue. So we're going to ask questions like, do you have a stent put in? Do you have do you have PT going on right now? Do you have a procedure coming up? Things like that. Are you in the middle of one cataract on one eye? And all those things will trip you up in medical underwriting. Same with Medigap, is we're going to have medical underwriting once you're beyond your 6 months. And if you want to change from carrier A to carrier B, you're still going to go through medical underwriting. So same questions, and you have to be kind of.
You get that quote unquote free pass when you're originally enrolling. It doesn't matter if you already have a cancer diagnosis.
Right. And that's where we're very, very, like I said, emphatic, where I think of this one guy I had with lupus, who just, I knew it was borderline for him to be able to afford it, but I just had to say, like, look, if you don't do it right now, you'll never get this thing back again, ever. So he took it. He's about a year and a half in, and there's just things like that we know, because on every single application, lupus is a no-go. He will never get qualified for that coverage. So, that's how it works. So it's very different from ACA. And that's where so many people come in with ACA in their head, like, well, they can't do that. Well, yes, they can. This is Medicare. This is not ACA coverage. Very, very different.
All right. I think that's a good place to stop, unless there's anything else you want to reiterate. I think it's a good overview. If anyone has any questions, Ferla Group clients, reach out to me. I'll schedule a call with Joanne or someone on our team, and we can go into, your individual situation, see what would apply or not apply to you.
Exactly. You got it.
All right. Well, thanks a lot, Joanne. I appreciate all the information. And again, if anyone needs any questions or help with this, reach out to us. We'll get you in touch with Joanne.